Autism spectrum disorders. It's a group of neurobehavioral condition. Nowadays, it's alarmingly increasing up to 2% of the society in developed countries. But in India and in other underdeveloped countries, it is not that much prevalent. But several stories and several features of autism made this word popular even in India also. There are three main features. Defective socialization. It means that they cannot become socialized. That is the word meaning of autism itself. Extreme selfishness. They don't want to look upon you. They don't want to care upon you. They will never mind upon you. And there will be defective language development. Maximum up to 2 years of age, there will be some language, and after that it will be regressed. Later on, probably all the language may vanish, and after that we need to develop it. Then third thing is purposeless, repetitive movement or behavior or interest. That is mainly due to some sensory issues. Sensory issue means all our sense organs, their sense organs work in a different way. They will feel that sound is extremely painful or distressful. Similarly, all 8 sense organs will be defective in functioning. There is no single medicine or treatment for autism spectrum disorders, and there is no need to. But at the same time, we need to convert those children into their autonomous stage. They should be independent. For that, we need to make several interventions. The main interventions are 3 types of therapies: speech therapy, behavior therapy, and occupational therapy. Out of occupational therapy, sensory integration therapy is utmost important. Later on, they need to send for life skill training, they need to send for ADL training, they need to send for inclusive education. Of course, Ayurveda has its own lot of evidence-based interventions, like there are several panchakarma treatments, there are several medicines for their metabolic health, gut health, so that they will become so calm, they will become sensory integration problem will become totally, it will be resolved. And of course, the therapy will work more if Ayurveda is doing along with this. And moreover, more than 80% of the global population of autistic children, they are in need of some alternative therapies. To decide this, knowledge is the best medicine. Whose knowledge? Parents' knowledge. So parent is the leader of all the therapies. Their knowledge decides the future of that child. So if they are in confusion, that means lack of knowledge, they should discuss with the professionals, and finally the clarity and scientificity of their decision makes the child's future perfect. They will become completely autonomous if you are doing properly all the therapies along with this sort of complementary and alternative medicines such as Ayurveda. And they can live up to their maximum, with their maximum output if you are doing perfectly. Otherwise, they will become totally dependent upon you up to your life.